Hello and welcome to the Parkinson's Foundation Cognitive Talk Series. Today's program is Thinking Changes in Parkinson's. I'm Erin McGee, a program manager for the Parkinson's Foundation. Some people with Parkinson's disease experience cognitive challenges, and the Parkinson's Foundation Cognition Talk Series focuses on those cognitive concerns. Parkinson's disease is complex and can take multiple professionals to work collaboratively to deliver your optimal care plan. All pre-recorded talks in this series are presented by one of our care team professionals who will help you to become more familiar with how each can add their perspective and recommendation for optimal living with Parkinson's. Today's focus is on the role the nurse plays in the Parkinson's care team. Before we begin, we want to welcome those of you who are joining us for the first time and take a moment to share our mission of the Parkinson's Foundation. Every day and everything we do, we are working to make life better for people with Parkinson's. To achieve our mission, we pursue three goals: improve care for everyone with Parkinson's, advance research toward a cure, and empower and educate our global community. Today's program is a great example of one of the things we are doing to help meet these goals. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. Thank you, Light of Day Foundation, for your support. We have started a new initiative meant to capture the community's perspective on various topics in Parkinson's disease, like mental health, telehealth, and even cannabis. By signing up for this initiative, we will email you up to 4 times a year, requesting that you complete a 10 to 20-minute survey. We will always report findings back to the community and encourage you to visit the link on your screen for more information. We will also share that in a follow-up email as this program is being recorded. Now I'm pleased to introduce our speaker. Jenna Iseringhausen is a registered nurse and Parkinson's Foundation Center of Excellence Coordinator at NYU Langone, Marlene, and Paolo Fresco Institute for Parkinson's and Movement Disorders. She is a graduate of The Ohio State University with a Bachelor of Science in Nursing and is currently pursuing her Master's of Nursing degree from NYU Rory Myers College of Nursing with an adult gerontology primary care nurse practitioner focused. She is a nurse faculty member of the Parkinson's Foundation Team Training, where she educates healthcare professionals on nursing care for individuals with Parkinson's disease. She works closely with the cognitively impaired population and their care partners within her center. Jenna has a particular interest on the impact nurses can make in assessing and monitoring for cognitive changes and educating people with Parkinson's and their loved one. So let's get started with the video.
Jenna Iseringhausen, and I'm a nurse at NYU Langone at the Movement Disorder Center, and I specialize in seeing those with Parkinson's disease as well as other movement disorders. Today, I'll be discussing with you the nursing care when it comes to working with you or your loved one in regards to cognitive changes with memory or thinking. So the first point that we'll talk about today is how do we as nurses use our training to help identify when you or a loved one might be having trouble with cognition. So the first thing that we do, which is a very large part of the aspect of nursing care, is collection of history. And what I mean by collection of history is looking at you or your loved one as a whole person, so collecting that holistic history. We're looking at what experiences you have with your body, also mentally, socially, emotionally, and also spiritually. We really tend to listen and observe and ask you those critical questions to help discover some of those key issues you might be experiencing. And then we take those issues and we help develop an individualized plan to help address those issues. It's very important during this part of our collection of history for you to feel comfortable and also realize that it's important for you to share your experiences and also your questions and concerns. No matter what setting you're in, whether that's the hospital, maybe you're in an office, a doctor's office, a clinic, or even speaking to the nurse over the phone, nurses are there to listen for some of those different indicators that could show us that maybe there are some cognitive changes that are going on. And what I mean by that is we listen for maybe changes to your mood or behaviors, observing how forms are being filled out when you're in an office visit or in an urgent care hospital setting, the different level of involvement maybe that you have during that collection of history. So how much are you able to recall different aspects of your care over time and to be able to give those as the nurse is doing that collection of history. And then we also look at the different types of challenges that you report or that you as a loved one report that your partner is having. And that would be challenges that include maybe different tasks that at one point were easier for you, like maybe doing the bills at home, where you could find certain things at home as well, or even maybe challenges in the workplace that have come up. We also look at the assessment. And the assessment for nursing care, that would be looking at you physically, so doing a movement exam, but also doing some cognitive exams as well. And we're also evaluating during these different aspects your ability to recall information, as well as ability to follow those directions as we're leading you through the different assessments. Another important aspect of nursing care for those who have cognitive changes, maybe that's you or maybe that's your loved one, is education. We as nurses are very trained in providing education around healthcare problems, and that includes physical, mental, and also social as well. We try very hard to focus on understanding the different people's backgrounds and aspects that might influence their ability to understand, obtain, and also interpret and perform those different aspects that are taught to them. So when doing this, a nurse will observe you for your ability to listen to and also understand that information being given to you. Many factors play a role in this ability to absorb that information and then also to be able to perform that information given as well. So we understand that. Different aspects such as mood changes or maybe distraction, perhaps you were newly diagnosed, things like that can play a role in a person's ability to understand. So we keep a close eye on those different aspects, but we look for these other obstacles to learning, such as those memory and thinking challenges as well. And then what we do is we communicate what we've observed to those different providers. So whether that's your physician or maybe that's other members of your care team, such as your social worker or rehab team as well. And together we come up with an individualized plan to try to help perform that better education for you. The next topic that we'll review today together is what a nurse or someone such as myself could do for you or your loved one or the person you're caring for if the changes are interfering with your quality of life, your mood, relationships, work life, or even putting your safety at risk. And so one main aspect that we really look at is changes to the mood or behavior. So have you started to maybe become more removed from doing different activities? Maybe you have less motivation, maybe agitation is more of an issue. And so what we try to look at is how that's impacting your ability to do different activities and to safely perform those activities as well. So we listen and also collect information such as When did these changes start to begin with your mood or your behaviors? Have they been going on for a while, or have they just started for you? Anything in particular that maybe you found has provoked these feelings or these behaviors for you? And do they ever lead to safety concerns? That could be things including perhaps arguments with you or your care partner. It could be falls as well. Maybe some impulsivity is a part of these new changes that you've experienced. So we as nurses then, we help obtain that information, get more of those details as well. And again, come up with a plan of action for next steps. This could involve addressing some of those different aspects of what might be provoking these feelings or changes for you, and how to intervene and prevent those from being provoked. Reviewing your medication list is huge as well. And are there certain medications that you feel certain ways after, or you notice changes after as well? Any new medications? And then also involving these different members of the care team. So we as nurses, we always communicate with the full care team to give you more support. Another aspect that we look for as nurses when it comes to different things with your cognition and with your memory that might be interfering with your quality of life is the ability to multitask, plan ahead, and also follow through on different tasks. Some people might start to notice some changes with that, such as tasks that at one point were very easy for you to do all at once have now become more challenging. So we look for that aspect as well. Is that something that you've experienced, or maybe that you as a care partner have noticed with your loved one as well? And that's important to bring up to us as a nurse. So again, we listen and observe for these changes and help educate and come up with strategies as well. Perhaps it's something where at work you've noticed that you're not able to do multiple things at once, or you're at home. Maybe before you could talk on the phone and do the dishes at the same time, but mistakes were happening or accidents were happening. So this is when we really encourage you to try to focus on one activity at a time. This is common, it can certainly happen, but by designating your focus on that one activity, you complete it safely and then also perform it to your full capacity as well. Different examples that we can try to educate on when it comes to challenges with multitasking or perhaps some forgetfulness would be setting these reminders for yourself. So you can place reminders maybe around the house or in the workplace in some of those key traffic areas. And that would include perhaps by the phone. Maybe you're going by the phone often, and at one point you were able to speak on the phone and remember the details that were coming up during conversation. So this is a time when you can take those notes and leave them for yourself as well. Maybe it's by the bed in the morning. You need to remember certain aspects of getting ready for the day. And so that could be also a good location. So really making it individualized for you and where those key traffic areas are. Also, completing different tasks. So if you are completing, at one point you were able to complete multiple tasks at once, that can become more challenging as we've discussed. So really trying to focus on one activity at a time. And that way we can be sure that you're safely completing those activities as well as being able to perform them to your full capacity. So we as nurses, we help work with you on these different aspects. And these are just a couple of examples of strategies. And so that's why we would really try to listen to what are those changes that you've noticed with the planning, multitasking, or following through on different activities that you've designated for yourself as well. And then we would help you come up with these different strategies for you. Another key aspect that can impair quality of life when changes have started to be noticed with memory and thinking is medication management. So with medication management, one thing that as a nurse will oftentimes ask you as a person possibly experiencing these symptoms, or maybe your care partner, we would look for, are medications being taken on time, or are they being forgotten? Perhaps you get busy during the day and it's just something where here and there you miss a medication dose. Certainly that happens and we understand that. But how can we try to prevent that from happening? And how can we know if this is something that could be related to memory or thinking? So if it's something that's happening often, then this is a concern that we'll start to have, because of course we want you to be taking your medications on time, but also safely, which means that you're taking the correct medication, you're taking it at the correct time and the correct amount. So oftentimes different strategies, if this is something that you've noticed that perhaps has become more challenging, we try to encourage people to maybe set alarms on their phone. This is something that there's the ability, you can actually set an alarm to occur every day at the same time. And so this can be helpful as well to just give you that prompt to realize, okay, it's time to take my medication. Other things, other strategies that can help with medication dosing is being able to put pills in a pill box as well for the designated times that you're supposed to take the pills. That can be very helpful. Some people at times will need to utilize a little bit of help from a loved one to set up that box, or to even maybe give those medications on time to make sure they're being given safely and effectively as well. Perhaps you don't have someone at home with you. You're someone that's noticed some of these changes and you don't have someone that can help you at home to put together these different pill boxes. There's actually a program, a pill pack program, that different pharmacies participate in. So I would encourage you to reach out to your pharmacy and see if this is something they're able to do. If not, then you can reach out to your provider's office and they can help connect you with the pharmacy that does the pill pack program. But what they do is they'll communicate with your different doctor's offices and gather your medications, and they'll put them together in these pre-packed forms, and they'll be able to designate it for the different times that you're taking the medications, make sure that you're taking them at the correct times and also the correct dosages as well. So this can help make sure that you're taking your medication safely and effectively as well. So one key aspect that's very important to discuss is the care partner. If you are a care partner or a family member or friend of someone who's noticed these changes cognitively, whether that's memory or thinking, it's very important to remember to take care of yourself as well. So nurses can play a key role with this. A big part of it is helping ensure that you have enough support. So encouraging you to surround yourself with support. And support looks a little bit different for everyone. That could be perhaps a family member that you have that you feel you can lean on at times, a friend, maybe you're part of a club or a support group. These are all people that at one point or another is important to have in your life. Someone who can give you extra support when you meet those challenges of your loved one at different times. Also, as a care partner, it's very important to accept help and to be okay with accepting help. Many people that I work with, that's one of the larger challenges, is being okay with having your loved one with those cognitive changes being at home at times. And that could be maybe with another family member or with a member of that support team that you've built around you. And that's another reason why that support team is so important for you to gather from the very beginning, because they can be there as additional people that are there to help you mentally, physically, spiritually, but also at times to stay at home with your loved one if maybe you feel that they're not able to be home alone safely. And so this is a time that you can really focus on yourself. Maybe it's taking an hour break once a day to go do something that you enjoy. But by having that social network and having that help, then it allows you to spend more time on yourself, caring for yourself as well. So going further into that aspect is that self-care. And what we mean by self-care is looking at yourself as a whole person and providing that designated care of what you need at that time. By the whole person, we mean spiritually, we mean emotionally, physically, especially. Oftentimes, care partners, you're so designated and determined to continue to deliver this awesome support for your loved one that might be experiencing these changes. But what's important is that you're able to focus on these aspects of your health. If you're not caring for yourself, then it's going to make it more challenging to care for your loved one as well. And so making sure you're going to regular doctor's office visits, staying in tune with your health, taking time to exercise and spend that energy and keep your body healthy. Sleep is so crucial as well, making sure that you're getting that optimal sleep too. If you're not doing these different things as a care partner, it can be harder to then work with your loved one that might be having these cognitive changes. And that could be energy-wise, it could be emotionally more challenging to work with your loved one, and also patience. These are different changes that are crucial to have this flexibility and communication with your loved one. And if you yourself are feeling fatigued or tired, that can be much more challenging. And so by accepting this additional support and accepting help around you, it allows for a little more flexibility and time for you to spend on yourself. I'm not saying it's easy by any means, but it's something that's important for you to prioritize. And so if you need help with that, this is something where a nurse can play a key role. We can help you strategize, we can help connect you with different social networks, and help connect you even with a social worker to talk to and lean on as well. Our next key point that we're going to discuss today is self-advocacy. And that might sound like a very strange term. What do I mean by self-advocacy? What I mean is your ability to then do these different tasks to advocate for yourself and speak up for yourself and your care. One of the first key aspects of doing this successfully for you or a loved one is observation. And observation is observing yourself or maybe your loved one. And these are observing for different changes, such as maybe that multitasking that we discussed, the planning, the mood or behavior changes, any of these little changes that you've noticed, or maybe they're bigger changes that you've noticed, but taking note of these. And then also taking note of when did these start to occur? Have they been occurring for a while? Maybe it was such a gradual onset that you didn't really even notice when it first started. Or maybe it was more sudden. If it happened more suddenly, that's when oftentimes we as nurses, we start to become a little more concerned for different aspects that are unrelated to Parkinson's disease. That could be maybe a urinary tract infection, pneumonia. So we would start to talk to you about different aspects of this. So the timeline is very important for you to observe and to gather when you're providing this information to your nurse or your other care partners or caregivers. Also, are these interfering with anything? Do you feel that these different changes that you've noticed, that it's starting to impair your quality of life? Is it interfering in the workplace? These are all very important to note for the first step to be able to successfully self-advocate. The next key step for self-advocacy is then taking those points that you've observed, that timeline of when the changes started to occur, what might provoke those changes, how it might be impairing your quality of life or your safety, taking those points and then discussing with your nurse or your doctor. And this is something that's a key feature, because if you're experiencing these things but not sharing it, then it's hard for any interventions to occur. And so at that point, by having your list that you've created and taking that different information, I would encourage you to either call your nurse on your care team. Maybe you don't have a nurse, so calling your doctor's office and speaking to the doctor's office in general over the phone, or collecting that information for your next office appointment. Because these are all very key features that can help a nurse or your care team figure out what might be bringing on these changes, teasing out the different aspects of maybe it's from medication, maybe it's from infection, perhaps it's a gradual change that's occurred over time, but then developing these interventions for you that would be individualized to what your specific issues or concerns would be. The next key aspect of self-advocacy and doing this as successfully and easily as possible for you would be coming prepared. And what I mean by coming prepared is when you're observing these changes that we've already discussed, taking note of them, not being afraid to write this down. Oftentimes we find as nurses that people become very overwhelmed perhaps by being in a doctor's office or finally getting someone on the phone to talk to about what these changes might be. And it's very easy to forget about what you've experienced or to not know certain details of questions that might be asked. It would be very common when you're calling in or speaking with your doctor about these changes or speaking with your nurse about these changes that they'll have more questions for you. And oftentimes by coming prepared with some written notes or written questions or concerns, it can be a little bit easier for you to be able to answer those questions. And so I would encourage you to come prepared with that. Also, having that information of timeline. Again, the timeline is so important as to when these changes have occurred. As nurses, we really try to tease out what might be causing some of these changes. And so we'll ask you more details that might seem a little bit odd at the time, such as, are you having urinary changes, meaning burning with urination, or accidents when maybe you weren't having accidents before. We'll also ask you questions about your movement. Have you noticed that suddenly you're having more tremor than you were before, or you're feeling much more stiff suddenly than you were before? These are all indicators that you could be fighting off some type of infection. And so we try to figure that out with you. Is this something where perhaps these memory changes you're experiencing are due to infection? And so we'd work with you on that. Also, a different aspect of timeline is being able to look at, is it more slow and progressive? And so by having that information with you that you have gathered and collected from the notes that you've taken, this can help us be able to deliver the best care as possible. So what do we then as nurses do as a part of your care team? And as a part of that interdisciplinary care team as well? What's our role? You might be wondering that. We've gone over some of the details as to what we do individually to work with you or your loved one, but what do we do as a part of the team? So oftentimes when you see a nurse, it might be your first point of contact with your care team. It could be at a hospital, an urgent care, a doctor's office. It could be speaking over the phone and triaging calls. And so oftentimes we're really that, again, first point of contact for you. We then will take that information that you've given us and we always communicate with your doctor. So we'll notify them of the different aspects or changes that you've been occurring and be able to come up with a game plan from there to see who do we need to loop into this situation further. So then nurses help advocate for your need for these different treatment teams, such as speech and language pathology, physical therapy, occupational therapy. They all are such crucial members of the team to get that baseline assessment and then also to give you, again, these specialized treatments to help with your cognitive changes and different strategies. And then we also communicate with social work. We'll pull them into your care team as well. We work hand in hand with social work oftentimes, nursing a little bit more on the medical side, social work a little bit more on the social side. But there are aspects that are intertwined within each of these different specialties. And so we as nurses, we help advocate for your need for these different services. And then we also communicate with these different services as well. So we discuss your progression through these different treatment plans. We talk about maybe any obstacles you've faced in being able to deliver on these treatment plans or follow through on these treatment plans. Perhaps it's a challenge with time or again, with the different challenges of maybe not having support at home. And so these are different things that we as nurses can help provide extra support for and help you meet your optimal goals. And we do that by communicating with your large team and being able to set that overall care plan together as a team as well. Key tips and strategies from today's presentation is to keep an eye out for any changes you or your loved one might be experiencing or challenges that might come up. No question or concern is silly. Don't be afraid to discuss this with your healthcare team. Connect yourself and your loved one with support. Nurses are here to help, to observe for these changes, advocate for individualized connection to the care team, and educate on strategies and interventions for cognitive changes. I want to thank you all for joining me today. I hope that you learned a little bit of information on what can be helpful and the impact that nurses can make on your care. And I hope you all enjoy moving forward and learning more about Parkinson's disease and what can be done to help with cognitive changes.
Wow, thank you so much, Jenna, for that great presentation. We have gotten quite a few questions in, and I really loved your takeaways. One that I really think is important is keep an eye out for changes. So just thinking of that, like, is there, your next statement was there's no type of silly concern. So if you see something once, do you want to bring it up, or like what would be the timeline? Not let it go too long? Is it too late after 6 months? Like,
That's a fantastic question. Yeah. And, we hear that a lot is what is the timeline? What should I be concerned about? And something to keep in mind too is that not everyone that has Parkinson's disease will notice changes. So you may not notice that you're having slowness of thought or forgetfulness or, concerned about what might come in the future. So just to keep that in mind that everyone's a little bit different when it comes to that. And when we're talking about cognition, it's here as a resource, but not saying that that will happen to you as well. So when it comes to the timeline, certainly I think it's helpful to take note of it, but not become immediately concerned, especially because there can be so many different reasons why something might be happening. Like we touched upon during that recording, that it could be something like infection. It could be something like medication changes. I would say that if it is something where you feel it's a significant difference and it's sudden, so whereas before you didn't feel any type of cognitive impairment, you didn't feel forgetful at all or anything, or your loved one, and then suddenly you've noticed you're misplacing things around the house, or maybe suddenly you're disoriented or your loved one is disoriented or confused. Those are things you should definitely call right away about to your provider. So even if it started the day before, if it's a significant change, definitely call your provider. And that's when those times will come up where they'll ask you more questions about really teasing out the symptoms and what you're experiencing, the timeline, questions about the urination, about coughing that could be indicative of pneumonia or any other type of infection. That's also where it's very important to collaborate with the primary care doctor and to make sure that you have a well-established primary care doctor as well. We do see that from time to time where things like that will come up and people don't have primary care doctors, and it's certainly more challenging to manage in that sense. So certainly, I'm a huge advocate for making sure you've got your full care team in line so that they can communicate with each other and help you as much as possible. When it comes to more subtle changes that you might be noticing, and that could be things like maybe forgetting phone numbers, or it takes you a little bit longer to come up with names of people that you at one point were much quicker at remembering, definitely take note of it and bring it up at your next office visit. If they're more of those mild changes, but they're not interfering with your everyday activities or quality of life, I think certainly something to monitor, but not to feel like you immediately need to call your doctor about. It's more of those sudden, bigger changes that you would want to make them aware of right away.
okay.
But certainly if there's ever any question along the lines and you're concerned, your doctor is just a phone call away, and you can call them about that as well.
That also reminds me of, like, when you think cognitive changes, it sounds so scary, but really the emphasis is that you're helping get more information so you can tease out what the issue is. And is there an issue with dehydration affecting cognition or other functions that could affect Parkinson's?
Yeah, that's a great question. So we do tend to see people with Parkinson's can drink less, and so can be more prone to dehydration. That can certainly impact blood pressure as well. So if you're not drinking enough water during the daytime, especially now with the push for exercise, which is, very important as well. But if you're not then replacing those fluids that you're losing with exercise, you can be more prone to dehydration as well. And so if someone is struggling with lower blood pressure too, along with the dehydration, they can have some additional forgetfulness, they can have more cognitive changes. Fatigue can be a part of that. Headaches, which can be distracting as well. So certainly hydration is very, very important.
Okay, thank you. One of the questions we heard you answer in the presentation, who's the best professional to diagnose cognitive changes? And I think you said you're the first point of contact, but what about those people who don't have a nurse at time of, seeing their movement disorder specialist or their neurologist? What other professional might be their go-to?
Absolutely. And many centers don't have nurses, and that's the reality of it. And so certainly other people that can be those frontline individuals that you're speaking with. It could be maybe a fellow, so a physician that's in training in movement disorders. Your center could have fellows. It could be directly with your attending physician. It could also be the speech and language pathologist or the occupational or physical therapist. They all play very crucial roles as well in monitoring for cognitive changes and also providing different interventions and different therapies that can be beneficial for what those specific changes are that you might be having. And so those tend to be, I think, for many people, more of those people that they're seeing more regularly as well. Maybe they have therapy 2 or 3 times a week. And so those people they might see more often even than a nurse or a physician in the doctor's office. So the great part about that as well is when you communicate with those other providers, really the key is that everyone communicates with each other. And so even if you bring it up to the speech and language pathologist, say that's the one that notices the cognitive changes and who provide you more guidance on that, you can even ask that they speak with your physician as well and make sure that they connect. And so that can be really helpful too. That way, that speech and language pathologist, they're going to be doing different assessments with you than necessarily a physician or a nurse would be doing. So they can give some really valuable insight into some of those different aspects as well, to then come up with a care plan together as a team. So I know that was a long answer to your question, but it can be a number of different care providers and specialties that would be the first people that might notice those changes, even perhaps people that you feel more comfortable bringing up those changes to, depending on what your relationship is with those different providers. So really, you can't go wrong with telling any of them about the changes. The key is then just all of them communicating with each other.
Mm-hmm. We had a comments come in from a viewer saying that the nurses they've met are often very busy and sometimes don't have the capacity to sit and listen. Would there be an option to find a private nurse? Or, I feel like I utilize my insurance hotline a lot when my clinic is closed or whatnot.
Yeah, absolutely. That's a really good question. When it comes to nurses, registered nurses in particular, they're oftentimes hired or, employed by a center. And so within the scope of a registered nurse's practice, there's typically, and it's all state-based as well, but there's typically not a way that you could hire an independent nurse, for instance, to be there to give you medical guidance. There are nurse practitioners, certainly, and also the scope of a nurse practitioner is a little bit variable depending on the state as well. But absolutely calling insurance providers, they can give you specifically different providers that accept your insurance plan that you could connect with, and they can even search within a geographic location too, to where you live, to better connect you as well. Certainly the Parkinson's Foundation helpline, I think, is great because, and I utilize the helpline oftentimes too, if there's a particular type of provider or specialist that I can't find in our area, or if someone is moving to an area I'm unfamiliar with, then they can also help find resources in those areas too. That is one of the challenges, I think, of healthcare in general, is because oftentimes people can have a lot of work to do. And I think finding people that you feel comfortable to speak with, and people that can take a little bit of time with you. And sometimes that can be done over the phone as well, rather than in person. So many times in different doctors' offices, they're given a set amount of time they can spend with you, and booked back to back with patients, which is, unfortunate that there is that timeline, but it's the reality of most medical systems here in the US. And so that's when at times you might be able to spend a little bit more time on the phone if you're able to reach out that way as well.
Okay, thank you. Got a couple questions about mood changes in Parkinson's. Is that related to Parkinson's, like quick mood changes, like 1 minute fun, next minute agitated? Another person wrote in that their loved one is having episodes of extreme agitation, hostility, and having a hard time with some of the doctor prescribed medications. Is that related to Parkinson's and meds?
So it certainly can. The key, I think, when there are mood changes, so we do see depression, anxiety, apathy, which is that lack of motivation to really take an initiative, to start tasks, to do things, to take on projects. We do see that with Parkinson's disease. Again, not everyone will experience that, but we do certainly see that with Parkinson's. The key with when those different symptoms are observed, and when it comes to agitation too, and almost having a shorter fuse, as you would say, so things that maybe at one point didn't bother you but now are bothering you, trying to figure out what those triggers are. So is there something in particular that's really just setting that person off? Is it maybe things being moved around in the house when they're trying to work harder at remembering where things are placed? So maybe some difficulty with coping with these changes they might be having, or difficulty coping with a new diagnosis of Parkinson's. So it may not even be cognitive changes. It could be something along the lines of, this is something new that I'm taking on that's now a part of my life, and how do I move on and continue to live my everyday life that I want to? And that can be a lot of weight on a person's shoulders, and on a care partner and family members' shoulders too, is the support. And it can be hard at times to know exactly what to do to intervene with that and to help. So I think the key would be communication. So certainly talking with each other. If you are the care partner and you're noticing these mood swings per se with your loved one, trying to talk with them about, gently calming them, normalizing what's happening as well, and being able to look at the situation and say, this isn't necessarily the person, it's the disease. And that can help sometimes to not be emotionally affected by the changes that you might be observing. So definitely communication is key. So talking about, are you feeling perhaps triggers that are provoking these emotions? Or is this something that you feel all the time and you're just really having trouble battling that on your own? especially when it comes to apathy and lack of motivation. That can be a really hard thing to overcome as well, and can cause frustration too to people around the person experiencing that. Especially when you hear so many people advocate for exercise and things like that. For someone that's feeling apathy, that's going to be a much harder thing to accomplish because of that emotional apathy that they're having. So in senses like that, definitely, bringing up those triggers, talking about, is it maybe being provoked certain times of day? So is someone feeling more fatigued certain times of day? And so then at that point, they're feeling more irritable or having more depression or anxiety. Is it in relation to medication times too? So as people are taking medications for Parkinson's, they may notice these fluctuations throughout the daytime. Not everyone does, but some people do. And those fluctuations can be physical, so meaning possibly worsening of tremor or worsening of slowness or rigidity, but it can also be non-motor. So it can be anxiety, it can be increased depression, apathy, it can be feelings of frustration that might worsen between those doses. And that can be provoked by the worsened motor symptoms, or it can be completely separate. So that's where it can be helpful for you all, as you know your body's the best, essentially. And so you are able to be around yourself all day, and you're seeing the symptoms you're experiencing, and care partners are often there, most of the time as well. And so not obsessing about these changes. You don't want it to overcome everything you're doing. You don't want to feel like you're keeping a extremely detailed journal that's all you're doing, but taking note of some trends, even for a week or so. And if you're able to see some consistencies with that, it can be really helpful then when you bring that to your provider's attention. And that, again, could be the nurse you're talking to, it could be the doctor. But all of those different aspects can really be helpful to see if there's maybe a medication change that needs to be made. Maybe a new medication needs to be added depending on what the symptoms are. If it's depression or anxiety that's not being helped, with other non-medication interventions, connecting with social work can be really helpful too. So they can do, depending on their licensure, but oftentimes can do one-on-one sessions with individuals with Parkinson's. They can do it with families and care partners as well, and they can help connect with resources too. So that's a really good mental health resource to have. Especially it can be challenging at times to find psychiatrists necessarily that accept insurance, or that are taking new patients, especially right now with the pandemic. And so many more people coming out with depression and anxiety and seeking help for that, which is great. But oftentimes what we're finding is that can make it harder to find those providers that are taking on new patients. So that's where a social worker can play a huge role too. But then also in that sense, if you ever call your insurance company, again, they can help connect you with psychiatrists or psychologists that are within your network and that are within your area as well for some additional support and talk therapy.
That answer was a wealth of information. Well, there's so many pieces I'm trying to pinpoint to follow up with.
Yeah.
Just this last piece about finding someone, first of all, communicating with your loved one, but then also communicating with someone else of how you're coping with it. It goes right along with a comment we got about how do you handle the anger, resentment of having a loved one with this disease. And I think you nailed it by starting that communication and finding help and educating yourself.
Well, and I think it's challenging. No one said that it's easy to cope with this illness and then cope with if you're noticing cognitive changes. But I do think, and I've seen people do better if they're connected to networks and support systems, and like I said during that recording, it's challenging, I know, to find the time to do those things, but really prioritizing that so that you're not letting the disease define who you are and what you're enjoying doing, you know, as a person with the disease, as well as a person who's witnessing it. And so continuing to find things that you enjoy, and maybe that's an activity together as partners. Maybe it's an activity separate from each other where you still have, you know, your own activities and your own support teams as well. I know, you know, there are different opportunities too, where like different community centers may offer sessions for people with Parkinson's at the same time as offering sessions for care partners. So a way to really, you know, have time where you know that both people are being cared for, but then it's also separate time where you can build your own support team as well. So that could be helpful to look in your own local communities as well for that.
Thank you. Got a lot of questions just about like how Parkinson's affects abilities to think and to manage everyday tasks, organization, staying on tasks, and really that executive functioning. And you touched on some of the ideas about having the list by the phone, by the bed. Are there any other strategies or takeaways that you could share that you shared in the clinic setting?
Yeah, definitely. So we do see executive functioning can become more challenging for some people, and that would include things like planning, organizing, multitasking. The multitasking, we probably hear a little bit more of a complaint as well. Some different strategies that could help with that. So eliminating other distractions can be helpful. So say, for instance, maybe before you're able to have the television on in the background or have music on in the background, that can sometimes be distracting from that one task that you're intending to finish. So while you're doing that one task, turning off those distractions. So eliminating that from being in the background. And then creating a list can be helpful too, a priority list. Sometimes people find that if they work with their care partner or their loved one on what are the priorities of things that I need to get done first or that I want to do first, and then working through those one at a time. So rather than moving on to the next thing before it's finished, doing that one thing until it's complete. And that way your mind is able to focus on that one task and then move on to the next. We do see that there can be a little bit of lack of flexibility, cognitive flexibility, meaning shifting quickly from one task to the next can be challenging, or immediately from one conversation to the next can be challenging too. So by really designating your focus and your attention on one thing at a time can be, I would say, one of the biggest takeaways with trying not to get distracted and completing those tasks in a timely manner. I definitely think too that in addition to decreasing distraction, as a care partner, asking one question at a time as well. So not having this long conversation and then asking 3 or 4 questions and then expecting the person to remember all of those questions in the order you asked. And so using a little more patience, but then also being mindful of asking that one question and waiting for the answer. And it might be a little bit slower than you were used to before, but just being patient and allowing that person to answer that one question before moving on to the next. So those can be a few helpful tips.
Yeah, that's like the answer to my next question, the ability Parkinson's affect social cues and communication skills, and who would be the specialist, or could they talk to a nurse or the doctor about those as well?
Yeah, absolutely. So communication can be challenging at times. word finding, and I think Dr. Goldman in the last presentation spoke a lot about word finding, but that feeling of trying to find the words you're saying, you know they're in there, but you're just not able to get it out as easily as you once were. So it's really the tip of the tongue issue there. And so sometimes that can cause frustration for the person experiencing it, but then also the person on the other end of the conversation. And so I think that's when it's really helpful to think about it as, there's no rush to having this conversation. The goal is for you both to communicate with each other and to understand each other. And so taking time to really, map out those questions one at a time and allow that person to take their time in responding as well. So I think that can certainly be helpful. And then in regards to communication, the speech and language pathologist is fantastic. Also, occupational therapy and actually physical therapy can be very helpful with that too. Physical therapy can focus on doing more than one task at a time. And so if that's something that you've noticed might be a change, they can do certain exercises with you and have you take those home with you as well to try to retrain yourself and work on those skills. Speech and language pathology and occupational therapy can focus on cognitive tasks as well and exercises, and speech can work on the communication aspect too. So really all three of them are valuable and really crucial members to add on to your team. And I would encourage people, even if they're not noticing changes, to at least go and get a baseline assessment from those providers, because they could give some good home exercises for you to do to continue to keep those skills sharp as well.
Mm-hmm. All right, we're almost out of time, so I'm going to try and squeeze in 2 more questions.
Sure.
Got a lot of questions coming in about medication. Is that a question a nurse can assist with, or is that something you should wait to talk to your provider?
Yeah, so nurses have quite a bit of knowledge on medications. We are not the ones, registered nurses are not the ones to prescribe the medications, but we are certainly the ones to educate on the medications. And that would mean educating on when to take them, what to take according to what the physician is ordering, how often to take it, certain side effects that could occur as well with those medications to monitor for. So definitely talking about your medications with your nurse. That's a big part of what a nurse does as well. So feeling comfortable with that. And then they would communicate with the physician or the nurse practitioner you might be seeing as well about everything you discussed either over the phone or in the office with them too. So they may not be making those medication changes, but they might be the one to relay that information to you as well and educate you on it as well.
Okay, and on that same line, would they share if they're wanting to seek out unconventional treatments or alternative treatments like toxin cleansing, vitamins, any other holistic practices? Make sure to share that with you or the doctor.
Yeah, absolutely. And that's a question we get quite a bit, especially when it comes to nutrition and vitamins as well, with Parkinson's in particular, and also with cognitive impairment. Some baseline labs that might be drawn if you're noticing cognitive impairments could be done to make sure that there's not something else that might be causing the cognitive changes you're having. When it comes to additional supplements or particular diet for Parkinson's or cognitive changes, there have been quite a few studies on different vitamins like omega-3s, vitamin B12, CoQ10, and we again get that question a lot. Many of the studies were with mixed results, so nothing that's really been conclusive as to if you take this vitamin, it'll help with your cognition or it'll slow the progression. It's still being studied, and I think there's still quite a bit of conversation around it. But as of right now, there aren't any particular vitamins or diets that are advised when it comes to slowing progression. Generally, we talk about Mediterranean diet because overall it can help as well with constipation and sleep and some of those other symptoms that can go along with Parkinson's. But if you're wanting to find a naturopathic physician or had one on your team, certainly make your nurse or your physician aware of that, and they can definitely work in collaboration with those other providers you have. Oh, you're on mute, Erin.
Yes, I just noticed that.
There you go.
I was just saying thank you. That was an amazing presentation, and there's just so much information to share. And I love how we connected, how you're, the touch point of the visit, but all the other disciplinary teams members that are there to help and support as well with cognitive changes.
Absolutely. It's so crucial to have that team involved. And again, the nurse is just one aspect of that. So if you don't have a nurse on your team, don't be devastated by that. But I'm obviously a little biased since I am a nurse. So I think we can play a big role in care for Parkinson's.
Yes. Well, thank you so much for joining us today.
Thank you.
And thank you to our attendees on Zoom. We'd like to also thank our program sponsor, Light of Day Foundation, for their support. Reminder, today's session has been recorded and will be available for viewing at the Parkinson's Foundation YouTube channel. As our program concludes, a window will open with a link to complete an evaluation of today's program. We truly appreciate your feedback as we use this to plan future programs. We will also send an email in the next week with the link to view this recording, other resources, and an opportunity to complete the evaluation, if not today. And in addition to our Cognitive Talk series, we are hosting virtual events every Monday. Oh, it's the first Wednesday of the month. It's okay. No tornadoes. We're hosting virtual events each Monday, Wednesday, and Friday of the week. To learn more and to register, please visit parkinson.org/pdhealth. Join us next week for social engagement, where we'll explore Shakespeare's poetry and plays, learn new ways to use Shakespeare's poetry and plays to warm up your body, increase your breath capacity, strengthen your voice, and improve speech agility, and enjoy the magic of his writing. If you had a question today that was not answered, please reach out to us by calling our helpline at 1-800-4PD-INFO or emailing helpline@parkinson.org. You can use the same contact info to order our free resources, educational book series, and our hospital safety kit. We thank you again for joining us and hope you enjoy the rest of your day.